Exactly 1 year ago, a disease caused by a new coronavirus was named. Since then, COVID-19 has claimed over 110,000 lives in the UK alone and created new images that will define our age. But what have we learned over those 12 months, and are we now repeating old mistakes? This is COVID Crisis, Learning the Lessons. Good evening, I'm Sophie Ridge. Welcome to a series of special programmes examining the UK's response to the coronavirus pandemic. Behind it, a comprehensive and detailed analysis of every significant moment of an extraordinary year. Over the next 3 nights, we'll be joined by the leaders who shaped that response and by some of the millions of people whose lives the virus has changed forever. Joining us tonight, Professor Neil Ferguson from Imperial College London, a key member of the government's advisory group SAGE, plus Sir David Nicholson, who as Chief Executive of NHS England led the health service through the swine flu outbreak. Joining them as we analyse the details, the data and the successes and failures of the response to the pandemic are Professor Devi Sridhar, a Senior Advisor on COVID-19 to the Scottish Government, and the former Head of the Civil Service, Lord Bob Kerslake. Now, we'll hear from them in a moment, but first, a reminder of how 12 months of personal tragedy, pioneering science and political uncertainty have changed our world, starting with the lessons around lockdowns and the effect on the British people, young and old.
I held her hand, not letting anyone I care for die by themselves.
I don't think anybody really understands how difficult it is on a daily basis.
They were like fodder on the infantry line.
If too many people become seriously unwell at one time, the NHS will be unable to handle it. From this evening, I must give the British people a very simple instruction. You must stay at home. I do think that we can turn the tide within the next 12 weeks.
Guided by the science, we'll act at the right time.
People are just stripping the shelves.
Today, we need to go further.
The United Kingdom is now in lockdown.
Please go home.
We are part of a community and we have to help each other.
Not going to school anymore. How do you feel about it?
Scared.
It's a moment when people across the UK come together.
Just need to buckle down for a couple of weeks, months and just get out of the way.
The Prime Minister is in intensive care tonight.
Another 786 patients have died in the UK.
An increase of 938.
An increase of 881.
More than 10,000 deaths.
I couldn't even be there to hold my mum's hand.
We will take a phased approach to reopening schools.
You can do this, then you can't do this. Very confusing.
They ruined my results. This is not what I deserve.
The government's U-turns on GCSE and A-level.
Feeling quite happy about coming back to school, although I'm quite stressed.
Quite accustomed to seeing Scotland do one thing, Wales do another.
It's a complete mess.
It's just ruining that first year at uni.
We're in a position where we don't know what's around the corner.
England will go into a second national lockdown.
It's just bad.
More than 50,000 people have now died.
Cannot continue with Christmas as planned.
Sick and tired of this. When is this going to stop?
People are not adhering to the lockdown rules.
We now have a new variant of the virus.
The United Kingdom will be under a lockdown from midnight.
I think people are tired.
Nobody knows what they're doing, do they?
The UK has surpassed 100,000 deaths.
We do know that things will be better in this country by Easter.
Such a sobering year. Let's hear from our panel then. I just want to start with a personal reflection. What's the one moment, event or memory that's really stood out to you this year? Professor Ferguson, to you first.
It's a difficult question to answer. I would just reflect that a year ago today, I'm the team I lead at Imperial College. We're just about to release tomorrow, a year ago, the report which first estimated the death rate of this virus to be 1% of those who might be infected. And I suppose it was that day and the following 2 weeks, really, the momentous nature of what we were doing and what we were living through became really clear to myself and my colleagues, just in terms of what the likely impact was going to be on society, almost regardless of what policy was adopted, either through lockdown, which would hopefully limit the death toll but have huge other consequences, or God forbid if lockdown wasn't adopted.
Yeah, we'll go back to that pivotal moment later on in the programme as well. Sir David Nicholson, what memory stands out to you?
I think, so at the moment, I'm also the chair of Worcester Acute Hospital's NHS Trust, and I think the thing that stands out for me is we, as you might expect, we're professionally getting our plans together, we're dusting down all the plans, looking at all the kind of emergency plans in place and putting all the governance arrangements in place to make sure we could manage through it. And then one evening, most of us saw some of the pictures coming out of northern Italy. And that, I think, really brought it home to everybody about what was really happening. Italy have got a decent healthcare system. In fact, they, per head of population, had more intensive care beds than we had. And they were clearly being overwhelmed. And that, in a sense, made it much more real and much more human. I think, that we were getting ourselves ready, but we didn't really know what for. And then we saw the human consequences of getting it wrong. And that really did, I think, galvanise people. I mean, one of the things about healthcare systems generally is that people are very parochial. They're only interested in their own. But actually, medicine is global. And it was amazing how many people we had in the hospital, doctors in particular, who had contacts, relatives, or had worked in Italy, or knew people in Italy. And suddenly we were inundated with FaceTimes with clinicians on the front line, pictures of patients, advice about how to do it. And it really galvanised everybody, I think, to really move forward and do some absolutely marvellous things.
Yeah, certainly those images from Italy, something I'll never forget as well. Well, let's pick up with the rest of our panel now, shall we? Professor Schridder, what's the one memory that stands out to you from the last 12 months?
I think it goes back to last January when there was a memo sent out by the World Health Organization that there was a novel pathogen that China had reported, and no one really knew how bad it was until January 23rd when Wuhan went into lockdown. We saw 11 million people get put into lockdown for 500 cases, and soon after, hospitals filled within a week. We knew this was not the flu. This was something fast-moving. It was human to human. And Chinese government was scared and was actually then moved to lockdown 66 million people. We had never seen anything like that. And that was the moment we saw countries start running, Taiwan, South Korea, East Asian countries, because they knew this was something that was very dangerous and they had to get ahead of it.
And finally, Lord Kerslake, is there a personal memory or significant moment that you will always remember?
Yes, well, my mind initially went to the press conference by Dominic Cummings on the 25th of May in the Rose Garden, somewhere I know. But actually, I want to give a more personal reflection. Recently at an event, one of the speakers said, "We haven't had time to grieve, to mark the terrible losses and the terrible impact on people's lives that COVID has wrought on us." And at the end of the event, he shared with us that his sister had died. And I think we'll all have those deep personal stories that we need at some point to recognise and reflect and grieve on.
Thank you very much to all of you for sharing those experiences with us. Now, to help us learn the lessons, Sky News has compiled the most detailed timeline of the thousands of events, decisions, statistics and stories published by any UK media outlet. Now, this helps us to understand the opportunities that were taken and those that were missed. So we can start with lockdowns and compare the government's first decision to lock down the country with what happened in January this year. Now, the first known death from COVID-19 is reported on the 11th of January 2020. It's after a man died in Wuhan. Now, the World Health Organization looks into what happened at the market at the centre of the outbreak. This is what it concludes, that there is no clear evidence that the virus passes easily from person to person. It goes on to say the WHO does not recommend any specific health measures for travellers. 11 days later, on the 22nd of January, Professor Neil Ferguson is at the first stage meeting of the year. I'm just going to read you some of the minutes. There is evidence of person-to-person transmission. It's unknown whether transmission is sustainable. And it takes until the 2nd of February for the UK government to issue its first piece of public health advice: wash your hands. But it's not until the 10th SAGE meeting on the 25th of February, more than a month after that first meeting, that SAGE discusses measures like isolating, working from home for the first time. Now let's go to the 3rd of March, when the government publishes its coronavirus action plan, where it's admitted that up to a fifth of the workforce may be off sick during the peak. In a news conference later that day, Boris Johnson says he shook hands with everybody on a hospital visit. And it's worth pointing out a paper from the SAGE meeting on exactly the same day says this: there was agreement that the government should advise against greetings, such as shaking hands and hugging. Now, a week later, on the 10th of March, the Cheltenham Festival goes ahead. 150,000 racing fans gather over 4 days. And on the same day, SAGE concedes that there is a need to reassess the advice on the risks around public gatherings. And then just a day later, on the 11th of March, the World Health Organization declares this is a global pandemic. On the 16th of March, Boris Johnson tells the public to only make essential journeys. Now, by this time, scientists at Imperial College London are projecting that if the UK does nothing, 510,000 people could die from COVID-19 by August. Now, during March, Italy, Spain and France all imposed a series of lockdown restrictions. And then, on March the 19th, Sky News reports from the Italian city of Bergamo, revealing to the world the scale of the catastrophe engulfing the Italian healthcare system.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. The doctors say they've seen nothing like it before and are warning other countries, especially the United Kingdom, that they will see it as well.
And this is the moment. 4 days later, on the 23rd of March, England, Wales, Scotland and Northern Ireland enter a national lockdown. Now let's compare that sequence of events with what happened at the end of the year. We can fast forward all the way to December the 3rd and the first SAGE meeting after the country's second lockdown ends. Now, the minutes show that they warn the government's plan for Christmas bubbles could prove deadly. They point to a slight shift towards a higher proportion of cases in older and more vulnerable age groups, which could lead to an increase in hospitalisations. 10 days later, on the 14th of December, the Health Secretary, Matt Hancock, announces that a new variant has been found in the south of England, with over 1,000 cases identified. Restrictions are tightened in some regions, but shops are still open, foreign travellers untested, schools fully staffed. Now, by the 17th of December, the Netherlands and Germany are in lockdown. France, Italy and Spain have national curfews. And we can look at the SAGE meeting for that day. This is what they say. It's concerning that case rates are continuing to rise in areas that have been in Tier 3 since the relaxation of national measures. Additional interventions may need to be considered, or there needs to be an increase in adherence to existing measures. Now, 2 days later, Boris Johnson announces that London, the South East and the East of England are going to go into a new Tier 4, measures less strict in March. But the announcement triggers a huge surge in travel, with long queues at London stations. Now, by New Year's Eve, 44 million people, that's 78% of England's population, are in Tier 4. And on the 4th of January, the Prime Minister announces a new national lockdown. Now, by now, 40% more people are in hospital with coronavirus than at the peak of the first wave last April. Well, let's go straight to Professor Ferguson, shall we? Now, you warned on the 27th of February that 500,000 people could die. We didn't lock down for another 25 days. Was that too late?
Clearly, with the benefit of hindsight, it was. I mean, I think one of the key lessons learned in this pandemic is that if you lock down earlier, you don't suffer the same deaths. And paradoxically, there isn't really a trade-off with the economy, because you probably can lift lockdown measures earlier too, just keep infection levels low. And the report of ours you mentioned, and the London School of Hygiene and Tropical Medicine did the same analysis, predicted way back in March that we would have to go into periodic lockdown to keep this epidemic under control. And that's exactly what we've seen. I think circumstances were a little different coming up to the third lockdown, in the sense that a lot of information came in really quite quickly around the new variant and how much more transmissible it was. So it did, in some ways, come out of the blue. But it's undoubtedly true. You just need to look at the data. Well over half of the people who died in this pandemic in this country have died in the last 8 weeks.
You say that the new variant came out of the blue, but at the same time, we knew how infectious it was on around the 18th of December. We didn't lock down for some time after that. And I know you said that you could have prevented around half the number of deaths in the first wave just by locking down a week earlier. Did we not learn the lessons there either?
I think we could have responded faster, but actually I think the tightening of measures, particularly around Tier 4, and then these cutting back on Christmas celebrations helped. We would have been in a much worse position had that not happened. I think, as I've said before, we would have been in a better position for the winter had we locked down earlier in the autumn. I think the most disappointing choice, you can always go back to March and say, well, people were balancing very difficult considerations. But by September, we knew exactly what this virus could do. And unfortunately, because in some sense the political consensus had fragmented, governments across Europe, and it's not a particular criticism of this government, reacted too late. And so it was only in October that we really tightened up measures, and only in November that we locked down again, and then not really for long enough. Had we learned the lessons properly from the first wave, then we would have been in a much better situation coming into Christmas, much lower infection levels, let's say, and therefore fewer deaths.
Fewer deaths. Let's bring in Professor Schridder at this point. We can see from our graph, this is the daily deaths in the first wave, obviously dipping down over August, but then rising again to a higher peak in the second wave. Professor Schridder, did we learn the lessons from the first wave?
Well, I think the perhaps mistake that was made was just to think about flattening the curve. As Professor Neil Ferguson said, we could see from the projections that health services capacity was here, and the idea was just to stay within it, which meant periodic lockdowns of going in and out, and you never wanted to exceed it, because then you'd have people dying because they couldn't get care. Where the countries that have really done well decided after their first peak or first bump to keep it low, not to ever have it rise. And they did that through having a functioning test, trace, isolate system, actually paying people to isolate, not to infect others, having really fast testing regimes, but also having border restrictions so you didn't have reimportation of new strains once you managed to clear and get on top of the ones you had.
Do you think the border restrictions that we've heard about today, for example, were too slow to come in?
Definitely. And I think if we look at the countries that have sustainably suppressed, meaning gone up, gone down, and then stayed low and managed to open up their economies and get back to normal life, they have had border restrictions in place. And there is a trade-off there, I think we have seen, which is, do you want to have a lot of daily normal life? Do you want to have schools open, shops open, pubs, bars, live music, live sports, stadiums full, but you can't go in or out of the country or off the island? Or do you actually want to have international mobility, but we live under restrictions in our daily life? And these are the really hard decisions in a pandemic. And we're seeing now, because of the variant and concerns over it and what it might mean for our vaccination program, that the government is saying, actually, we got to take this seriously. And I think we will see more and more countries moving to managed isolation: Norway, Finland, Israel, Canada, and now here in the UK as well.
Well, let's talk to Lord Kerslake next, shall we? Scientists obviously focusing on the best way to suppress the virus. Often that is lockdown, but politicians have to balance that with lots of other things, don't they? Education, mental health, the economy. Do you think the government got it about right?
Well, they do have to balance a lot of things, and this was an extraordinary time. You've got to recognise just how unusual it was for any government to face. But I think the government made a number of errors, really. Firstly, I think they often tried to split the difference rather than take decisive action in one direction or another. We've heard some of that in others' contributions to this discussion. I also think that they listened too much to the debate that was raging in the newspapers about lives versus livelihoods and the fact that the numbers were going up or going down at any particular time. In truth, this wasn't a lives versus livelihoods debate. It was about lives or more lives being lost. And I think they could have and should have been more decisive. I think in the last lockdown, they have been more decisive in terms of their actions, and that's having an impact. But earlier on, I think they were indecisive. And in fact, I think in the summer, they declared victory too early.
Interesting. Let's bring in Sir David at this point, shall we? The UK could end up with one of the highest death tolls, but also, according to the OECD, the biggest economic hit of any major economic country apart from Argentina. What do you think the lessons are?
Well, first of all, you have to learn them. And I hear all this about, we can't have a public kind of inquiry into all of this, because afterwards, well, how on earth are we going to get better? The way you get better is to recognise what you've done and then change as you go forward. And it didn't take a genius to work out. And, at the time, I'm not engaged in the national picture. I'm, the chair of a hospital trust, but we could fairly clearly see that case rates go up, hospital activity goes up a couple of weeks later, and death rates go up a couple of weeks later after that. It didn't take a genius to work that out, but it seemed to us anyway that it wasn't being recognised by the centre. I mean, from my perspective, and I'd be interested in Bob Kerslake's views on this, I just think they got the whole thing badly set up from the beginning. Now, I've been engaged in a whole load of national issues, although nothing like this. And it is incredibly difficult, when you're dealing with these sorts of things, to make the right judgments. But a couple of things that you learn from it. The first thing is that the Prime Minister makes the big calls. No matter how you organise it, the Prime Minister makes the big calls. And the Prime Minister needs to have a proper setup around him to enable him to make those big calls. And what was clear to anyone looking in is they simply hadn't got their act together in terms of how they were going to do that and make it happen. I say Bob is a better position to do that. And the second thing was, when you're making decisions from a national perspective, it's a real drive to make them happen. They don't just happen because you say it. Many politicians often think that, that announcing something is the end of the story. Actually, it's implementation that's the big issue. And when you're doing that, you have to have the courage of your convictions. You can't half do things. And that's why, Bob's point about trying to do the middle range. You have to have conviction. You have to recognise it and then do it. And I think we didn't see more, and we still don't see too much of that.
Well, let's bring in Lord Kerslake at that point, shall we? What is your view? Is the structure of government not really set up for this?
I don't think it was set up properly at the beginning, no. And some of that is the fault of inadequate contingency planning prior to the pandemic, and all of us, including me, must take some responsibility for that. But I also think we had really a very centralised approach with a weak centre. That was my observation. Schools, universities, hospitals, shops, all wanted to do the right thing, but they found themselves struggling, I think, very often with confusing and changing decision-making and direction. And that, I think, was a real challenge. We needed to entrust local areas to make more of the decisions, but exactly as David said, we needed, if you like, government with conviction and clarity. And I'm afraid we didn't get that along the way on a number of occasions.
Professor Ferguson, you were sitting in some of those meetings with the government. Did we get that clarity of purpose? Was there the leadership shown?
It's a difficult question to answer. I mean, I mostly interacted with Chris Whitty and Patrick Vallance, who I think have been excellent throughout. I think there were challenges. I think the major thing we mentioned before, hospitals filling up. When you're dealing with a crisis, there's always a lot of uncertainty, and there can therefore be, in some sense, hesitation about making really cataclysmic decisions when on the basis of limited information. And I think there was an element of that. And only when we saw hospitals start to fill up in London when we started getting the first reliable data through really about the 11th, 12th of March. Did it clarify minds? I mean, I remember sitting in a SAGE meeting the previous week, in fact, looking across the table at somebody who will remain nameless and saying, I mean, do you know what this epidemic is going to look like if we don't act soon? Then, and I think that reality on the ground was, as much as anything else, beyond all the scientific advice, what probably shifted policy. Initially to announce a Swedish-style voluntary lockdown on the 16th of March, and then to the compulsory lockdown on the 23rd of March.
OK, well, we're talking a lot about the health factors of lockdown, but the impact, of course, was really felt on the economy. Particular sectors have been devastated, including hospitality. Well, joining us now is someone who's felt that firsthand, the chef, restaurateur and pub owner, Tom Kerridge. Thank you very much for being with us, Mr. Kerridge. What a year it's been for people in your role. How's it been like?
Yeah, it's been very, very difficult. I think the first is the fear factor for people's livelihoods and jobs, and particularly your colleagues and friends that you work with, staff. And first and foremost, it's been ensuring that they feel secure in their positions, that, you act as a business owner and as a leader. You're trying to ensure that you're trying to put their minds at rest. But at the same point, as business owners, we've also been looking for guidance and some real infrastructure and understanding of how we can get out of this. And it has been a very, very difficult year. Yeah, I mean, the parallels and the movement of the rules have constantly been changing. And hospitality has been one of the industries that have been at the cliff face of it, that's been really up against it, but has, adhered to all government protocols, tried to be as operational as possible, fitting with COVID safety. But still, we end up in this position where we're closed. But, we are like many other industries, like the arts, like travel, like tourism. There's a lot of businesses and a lot of sectors that are really struggling, are facing an uphill struggle to get out the other side.
And it must be hard when you feel responsible for people's livelihoods, their jobs. I noticed that 7 out of 10 pubs and restaurants told a UK hospitality survey in November that they could close in 2021. I mean, we're talking like an awful lot of businesses here on the edge.
Yeah, the one thing that makes hospitality the most amazing and brilliant industry to be in is because when we join it, as I joined it as an 18-year-old, you're in it because it's passion, heart, soul and love. And most people that are in hospitality are in it because they really enjoy doing it. They obviously, the businesses have to try and operate as a profitable business, but they're very, very fine lines between profit and loss. Even if you see pubs and restaurants, you assume that just because they're super busy on a Saturday night, that they must be making loads of money. That's not necessarily true. The EBITDA percentage margins are really quite small. So the moment that you get those, they start shrinking away. Businesses that then start operating at a loss. And then, if businesses this year have been struck with a huge amount of debt, being able to service that debt coming out is very, very difficult. If those profit margins and percentages are really small, how then those businesses are going to service those debts when we can reopen is going to be very, very difficult. And that's where it will lead to closures. And I know we talk about in this industry that it feels like it'll be a sudden the moment that the furlough scheme is removed and that government support system is taken away, that many places will close. It won't be like that. What will it be? It'll be a very slow, quite painful death for many businesses, because they'll try to reopen, they'll try and keep their staff going, they'll try and keep those movements and try and increase that business. But it's not going to suddenly bounce back. And what will happen is that the debt load that many businesses would have taken on over this last year to service that debt will be so it will start dying off. There will be many businesses that just can't reopen. And then there'll be many more over the next 12 to 24 months, I think, that will struggle quite a lot.
We've seen, of course, some government support schemes, the furlough scheme, the Eat Out to Help scheme, to try and help businesses who are really fighting for their lives. At the beginning, of course, when the pandemic first struck, things were very uncertain. But do you think things have improved in terms of government support?
I think that government support has been very, very good in terms of the furlough scheme and in terms of for staff. And then I think the words spoken have been great in terms of for hospitality in particular, where VAT being reduced to 5%. although that's great for accommodation and food-led pubs, we haven't been able to be open to make any use of that. So that's something that we would be desperate for the Chancellor, particularly coming in the next budget, to be looking at extending those VAT cuts so that it gives businesses opportunity to move forward. You know, the business rate support scheme has been fantastic. I would hugely encourage that to be going. And also in terms of the furlough, being able to move forward, we need all of that to regenerate those businesses. But what we really need is government to actually listen. And when they listen, we need them to hear and take on board. So, you know, I found myself in a relatively fortunate position to be a voice and being able to listen and be a part of conversations moving forward. But what we really need is that voice, that penetrating voice that goes into Whitehall, that has a complete understanding of the hospitality industry. So that puts it in a much stronger position to come through the other side. And what hospitality, I mean, it's an employer of over 3 million people within this country, and that's just straight into hospitality. That's not just the supply chain that's added on top of that, which is another 2 million people, the farmers, the fishmongers, the bakers, the kitchen suppliers, the furniture makers, all of these people that are involved in hospitality. It's such a huge sector. And what we need is a kind of a positive outlook from the government. We need alignment with understanding of how we can move forward. We don't want, made up things. You know, stories being leaked of pubs that can open with no alcohol. That's no help. That's not helpful to anybody. You know, we need a clear and defined, I suppose. Yeah, exactly. We need information from government requirements regarding COVID safety. We need a definitive plan of action. We need as much notice as possible for us to be able to build forward and moving forward. Because hospitality isn't just about pubs, bars and restaurants. It's much more. It's the beating heartbeat. It's fabric of society. It's a network of people that keeps moving things forward.
Thank you so much for coming on the programme and really kind of outlaying the challenges facing your industry. Tom Kerridge, thank you. Well, let's go to Professor Schroeder, shall we? We heard there, didn't we, really, I guess, an example of why the economic argument is something that we can't take our eye away from. Is it fair that the government has been trying to keep that on board as they've been doing they've been trying to find their way through the pandemic?
I mean, definitely. And I think in public health, we are highly aware that lockdown has consequences on health outcomes. We know child abuse has gone up. We know inequalities are increasing with schools being closed, and unemployment is bad for people's health and for all, the increasing use of food banks. So I think the mistake that we've made is to try to flatten the curve and go into repeated cycles of lockdown instead of actually saying, how do we exit this once and for all and get a full domestic recovery? But that requires fully suppressing the virus. We can't lock down society forever. So the question is, how do you suppress without lockdowns, and what countries are doing it? And there are countries that are doing it who are winning. You could look across to East Asia, you can look to the Pacific, and the way they're doing it is through having, perhaps a hard lockdown at the beginning, harsh, get those numbers low, keep them low through rapid testing, making sure people isolate when they're infectious, that they don't feel like they have to go to work to earn. And then you also keep your border restrictions in place not to import new strains. And then you open up slowly. And then you will have flare-ups because the infection is now global. So when they come up, you go hard, you put out the fires, and you try to keep society running. Because I think the repeated cycles of lockdown are pretty catastrophic. And I think we are seeing the consequences already.
At the same time, though, is it fair to compare the UK to other countries? I mean, it's much easier to close off the borders in New Zealand than it is in the United Kingdom. You're talking about countries in Asia, for example, with test and trace. Well, they have much better surveillance of people that there are going to be privacy concerns about in the UK as well, aren't there?
Yeah, so there's trade-offs. And I think that was the message that's been clear since January. And it's, what do you prioritize? And right now, I would say what we've prioritized has not worked out that well because we're shut in our homes in a lockdown. We have hospitality, as we've heard, collapsing. We have kids out of school with no easy way to get schools open quickly. And we have 100,000 deaths. So obviously, the route we've taken a lot of costs without much benefit. And so I think we should have had that discussion over, okay, is tourism going to be hit in aviation? Well, how do we then target our economic support at them, but let domestic hospitality run? Or are we going to actually have more infringements on, let's say, people's movement, trying to regulate isolation in hotels or through apps, but that means people get, the ability to move around their homes. So I think these are the kind of debates we had to have, because there are trade-offs in a pandemic, and trying to pretend they're none leads us to being forced into reactive lockdowns, which is where we've now been for about a year.
I just want to bring in new variants, something that lots of people are very worried about at the moment. And Professor Ferguson, NervTag has said that this mutation of the Kent variant found in Bristol today, they've described as a variant of concern. How worried should we be?
I think it's concerning. The key difference between this variant in Bristol and the new variant we've been dealing with the last few months is a mutation E484K, which is probably the difference between our new variant and South Africa in terms of allowing the virus to partially escape immunity. And that's the concern. So it's as transmissible as the new variant we've been dealing with, but has this one additional mutation which may affect, and I say may affect how effective vaccines are at protecting people, and probably doesn't have any effect on transmissibility or severity. But the key issue is if this virus, this new variant of concern, can even partially escape immunity, it makes control going forward that much more problematic.
I know things are very uncertain, but, people will be worried if this new variant could potentially interfere with the vaccine. Is this an argument for locking down harder, for perhaps continuing the lockdown for longer until this new variant is under control?
So certainly, I support the intensive testing measures being put in place in Bristol, which are trying to detect as high a proportion of people who may be carrying this variant of concern and isolating them, and then therefore driving down its prevalence. As to does it require the lockdown to be in place for longer, the one good thing at the moment is that in all areas of the country and for all variants, case numbers seems to be dropping. But relaxing does pose challenges with new variants, and particularly a variant which might even partially escape immunity. If that was able to take off, that would be very problematic. So as in throughout this pandemic, there are many factors to consider and no easy decisions to make, really.
Yeah, no easy decisions. Feels like it's been the theme of the last year, certainly. And thank you all for a very interesting first discussion. Now, I want to focus on education, because it's been one of the most challenging issues during the pandemic. And as our timeline lays bare, classrooms, exams and universities have all been severely disrupted. But almost a year on, students, parents and teachers are still struggling with inconsistencies in the system. So let's look at what happened the first time round. On Wednesday, the 18th of March, this is when the government announced that schools would have to close by the end of the week. And they were reacting to a SAGE meeting that day that said the evidence now supports implementing school closures on a national level as soon as practicable to prevent NHS intensive care capacity being exceeded. It's 10 long weeks after that primary schools and nurseries start to reopen on the 1st of June, just as the first lockdown starts to come to an end. But by the 9th of June, the plan for all primary schools to be open before the end of term is scrapped after pressure from teaching unions. Secondary schools, sixth forms and colleges are allowed to open for face-to-face contact 2 weeks later, but many choose not to. Now, SAGE meets on the 23rd of June, and they say that there may be a need to change measures at the end of the summer in order to be able to keep R below 1 while proceeding with the planned reopening of schools. Later that day, the Prime Minister says a return to school is safe. But in areas where local lockdowns are being imposed, like this one in Leicester, schools are forced to shut again. The 13th of August is A-level results day in England. According to Ofqual, almost 40% of grades in England were marked down by 1 grade or more by the standardised model drawn up by the regulator. That's 280,000 entries adjusted. Students across the country are soon protesting, and within days, on the 17th, the Education Secretary effectively scraps the regulator's algorithm. Students start returning to university in September, even though a SAGE meeting from the first warns that social activities and living in halls pose a greater risk for transmission than teaching on campus. And on the 26th of September, more than 30 universities are dealing with outbreaks, most prominently in Manchester, where 1,700 students are forced to stay in their rooms for 2 weeks. Now, on the 4th of November, MPs vote in favour of the second national lockdown, which will come into force the next day. Schools stay open. Now, SAGE meets that day and they reiterate school closures have an impact on the physical and mental health of children. But on secondary schools, they are clear. Children aged 12 to 16 played a significantly higher role in introducing infection into households. On the 3rd of December, students are told they can go home for Christmas if they test negative. SAGE meeting minutes that day say that lateral flow testing should not be seen as a way on its own of enabling high-risk activities to take place, but could reduce the risk of activities being undertaken. On the 14th of December, with a more contagious variant of the virus confirmed, despite a warning from one council of exponential growth that demands immediate action, the Education Secretary uses legal powers to force 2 councils in London to keep schools open. A week later, the Department for Education emails recommend mass testing in schools when they reopen in January, and that day's SAGE meeting hears that R would be lower with schools closed, with the closure of secondary schools likely to have a greater effect than the closure of primary schools. 1 week after that, Gavin Williamson tells MPs the overwhelming majority of primary schools will reopen as planned the following week. And on 4th of January, despite widespread confusion about the rules, that does happen for a day, only for Boris Johnson to announce a new national lockdown for England that evening, including the immediate closure of all schools. At the end of January, it's announced that children won't go back to school after the February half-term, as hoped, with a new target to reopen classrooms from the 8th of March in England. That's 2 weeks later than planned in Scotland and Wales. Well, let's hear a bit about what that's all meant for the people involved. We can speak to Kieran Murrell, who's a university student whose studies have been really severely disrupted over the last year. Thank you so much for being with us. I can see you're smiling now, but it's been a difficult time for students, hasn't it? What's it been like?
It's been absolutely awful. It's been such an incredibly lonely time, and it's felt so upsetting, and it's been so hurtful to work so hard to get to university and be actively encouraged to return to university in September, to get here and have those hopes of some sort of normality be instantly stripped away, and being told that we wouldn't be on campus learning with our peers and interacting with our peers.
Just tell us a bit about yourself. Where are you studying? What are you studying? What's the last few months been like?
So I'm studying at Bournemouth University. I'm in my second year doing psychology. And the last few months have been really hard on my mental health. This is probably the most I've ever suffered. I felt a huge lack of support from my own university, and I wasn't receiving feedback on assignments in time that I should have been, which meant, as a result, further assignments were suffering because I couldn't improve myself. I couldn't work on myself. So I was finding myself really struggling. And then, just feeling really alone. I haven't been onto campus since March last year, and that's not looking like I'm going to get onto campus anytime soon again.
You see, we talk a lot, don't we, about the health impact, about the economic impact. Do you think we've spoken enough about the mental health impact that so many young people are really suffering with?
Absolutely not. There's been a huge increase in students' mental health, and the amount of students that are now going to their universities in need of mental health support, that universities are feeling incredibly overwhelmed because, students are being isolated physically and mentally. Being stuck in student halls or in a student house is so lonely. Even if you're living with other students, you're away from your families. I've got some friends who haven't been home in months. They're international students. They spent Christmas alone. And that's had a huge impact on their mental health because they're not seeing their loved ones and they're stuck in this country which is completely alien to them.
Thank you so much for coming on the programme. It's so important to hear, the personal experiences of people like you. We do appreciate it. Thank you. Well, let's go to Lord Kerslake. I just want to talk to you in your capacity of Chair of the Board of Governors at Sheffield Hallam University. Just hearing there from Kira saying she just hasn't received the support she would want to from her university. Do universities need to take a bit of responsibility here for not always stepping up?
Well, my sympathies are entirely with Kira. I think she's obviously had a terrible experience. And yes, universities have a big responsibility to support their students. No university that I'm aware of wanted to stop face-to-face. And it's been a real loss to us that it's happened. We're acutely aware of the stress that it causes to students. And I think most universities, I would say, have done a lot to put in extra support to students to help them manage through this very difficult time. And I think just a wider point to make here, whilst I actually think the government have done some good things in relation to the economy and employment, there are very few redeeming features as far as education is concerned. And what's most frustrating about it is that some of the things were both predicted and predictable. The U-turn on exams, for example, I can't imagine what it was like for students who were marked down and then had to wait whilst the issue was debated in Parliament and elsewhere. So yes, universities have got to deal with this. But I wanted to say a quick word about schools, because I seriously worry there, not just about the loss of education, but the mental impact there. And we are going to need a national recovery programme on schools, as well as something to help students recover on their education. Otherwise, they will be not just temporarily damaged, as this has done, but permanently damaged in their future careers. It's an absolute responsibility to address this in the recovery.
Well, let's talk to Professor Schudder about schools, shall we? Because different nations are doing slightly different things here, aren't they? So in Wales and Scotland, younger pupils returning from the 22nd of February. In England and Northern Ireland, schools closed until at least the 8th of March. When should schools start reopening?
So I think what's absolutely clear is that children have borne the brunt of this pandemic, and there are massive harms to children being out of school, and schools should be the first things to open and the last things to close, even if we have to keep in place restrictions in other places. And there is also an age gradient we've learned about, which is we've seen much fewer outbreaks in nurseries, and we've seen it go up. So the older the age cohort, the more outbreaks you seem to see. So what we're trying to do in Scotland is 22nd of February, get the youngest kids back, early years, P1 to P3, and then get them back to some normality, assess that, and then cautiously start expanding out to get kids back. One of the great things that we saw last summer was because we managed to squash the numbers really to elimination levels. We had few cases. When we opened schools, 76% of schools, had no cases until, mid-October, November. And of the schools that had cases, it was just one case, and then Test and Trace came in and was able to isolate that child without it spreading. So there is a way to run schools effectively, but it does require suppression so you don't keep having cases in school. Right now, the restrictions are in place, the numbers are coming down. Let's hope we can get schools open.
OK, have you been on a bit of a journey yourself? I just wonder, because you talked a lot at the beginning of last year about locking down, about zero COVID, about suppressing the virus, and it feels that more recently you've been talking a bit more about schools reopening. Is that fair?
Well, I think actually, I've always been someone who wanted to follow the East Asian model. So I think for me, because I was following this from January, and so I was thinking we need to treat this like a SARS-like infection and follow that model, which is, you try to suppress it or eliminate it. You just get rid of it. And so that's been my consistent stance. But I think right now what I'm seeing is we're a year into this and we don't seem to have a coherent strategy. So in a way, either say we're going to go for elimination, we shut down everything for 3 weeks, we clear the virus, we open everything, or we say, OK, we have to live with it. If we have to live with it, how do we get kids back to school? Because we can't be in this position next winter. So I think that's where I've got to, which is, we have to get kids back because we can't sit here in this kind of circular state of not getting anywhere farther.
Professor Ferguson, what does the science say about children? Because it feels like it's been quite confusing. Do they spread the virus? Are schools vectors of transmission? Are they safe? What's the answer?
I think it's confusing because there isn't a simple answer. I largely agree with Debbie that there is a gradient, and so certainly young children have not been so far significantly implicated in transmission. But teenagers, particularly older teenagers, seem to transmit just as effectively as adults and have many more contacts. And I think the difficulty we face now with the new variant, which I should emphasize doesn't specifically target teenagers or children, but it is overall 50 to 70% more transmissible than the variants we've had before. And that means the reopening schools poses some risks. I agree with the Scottish approach of a staged approach of opening primary schools first and assessing what that does, and then only moving to opening secondary schools. I'm also very, very conscious of the both educational and social harm that keeping schools shut entails. And therefore, I completely agree again with Debbie that, schools are the thing we want to open first if we're going to open anything.
So, David, talking about the harm to our young people, you're a father yourself, I know. How alarmed should we be about the sacrifice our young people are making? Disadvantaged children in particular, I guess.
Absolutely. And in any environment where mortality is the issue, children always suffer. In anything that we try and do, and we need to mitigate for that. And this kind of reinforces this idea about conviction about what you're going to do. If you believe that opening schools, and it has to be the right thing, is a big priority for us, then we should do stuff to make it happen. And one of the things that really struck me particularly, I said it at the time, was when we opened the schools originally during the first lockdown for staff who were in the NHS. That was a test bed for us to learn how to do it and to arrange it. When we do it now, we have the schools open for frontline staff. We should be testing and learning how best to do that, so that when we do it, we're particularly well organised. If you look at our mental health services in the NHS at the moment, they are potentially overwhelmed by child mental health, quite serious mental health problems amongst children around all of this. And this is a big issue, I think, that Bob Kerslake talked about in terms of the restoration, about how we're going to make this much better for children going forward. But I think, getting the schools open, if it means, and our clever people than me can work this one out, but if it means vaccinating teachers, we should vaccinate teachers. If that is our priority, then we should do whatever it takes to make it happen. Okay. And don't sort of, fiddle around the edges and hope something's going to happen. Because all of our experience here is that, the old adage, I remember when we did other things, and the chief medical officer at the time was Liam Donaldson, who was an extraordinarily cautious individual in lots of ways. This idea of hoping for the best but planning for the worst. On almost every occasion now, it's been the worst.
Good advice there.
So
it feels like there's been quite a lot of agreement on the importance of opening schools. I just want to pick up on something that Professor Schroeder said a few moments ago about what things could look like in a year. Professor Ferguson, what do you think things will look like in a year? Are things going to be completely back to normal? Are we going to have a low level of restriction? What do you think?
So I think the vaccine we're rolling out now will have a very major effect on deaths. With the caveat, I think we'll need to implement another vaccination programme in the autumn to deal with new variants, and perhaps even sooner than that. But with the levels of uptake, which are very encouraging, we're seeing in older people over 90% in the over 75s, that will, even though the vaccines are not perfect, that will still have a very major impact. It's not going to allow us to go completely back to normal, certainly not until the autumn. And I suspect there will be new things we can't predict precisely, like the waning of immunity, like new variants coming up, which means there will be some residual need to maintain some social distancing, mask wearing, probably for much of this year. But as vaccine manufacturing capacity gets ever greater, and as we update the vaccines and get ever more effective vaccines, I'm hoping that by this time next year, it will look a lot more normal. Maybe there'll still be mask wearing for mass gatherings and things like that, but I very much doubt we'll be anything like where we are now.
Interesting. Thank you. So potentially some low-level social distancing, mask wearing, even into next year. Professor Schroeder, do you agree with that? The fact that actually some sort of restrictions could be here for a lot longer than we perhaps anticipated?
Yeah, well, I think the thing we want to avoid is having the situation this winter of largely the economy being closed and schools being shut and having the NHS almost overwhelmed. And I think people should be optimistic because we do have a number of vaccines. Last January, we weren't even sure we'd have one vaccine, and now we have at least 5, which are safe and effective. And especially the mRNA vaccines can be changed for the new variants if they can do that quickly enough and get out. So I think right now, where are things going? Best case, we see that vaccine roll out. In 6 to 8 months in the summer, we have most of the population covered. By the autumn, even vaccinating children. I know they're being trialed in children in the United States. And then you kind of reach a status where if they stop transmission, we can actually, continue on quite normally, like how we've dealt with other infectious diseases. The variants are the real unknown. And right now, the South African variant, the Brazilian one, these are warning signs to us. We might be able to manage these, but as long as the virus is circulating somewhere in the world, it could always come back in a slightly different form and a more challenging form. And we need to plan for that to avoid it because we don't want to be in another lockdown.
Interesting. It does feel like COVID-19 could be with us for quite a long time, if not forever. Thank you all very much for a fascinating discussion. Professor Ferguson, Sir Nicholson, Sir David Nicholson, Professor Debbie Schroeder and Lord Bob Kerslake. Thank you all very much. Well, that is it for this evening. But tomorrow we're going to be looking at some of the measures taken to beat the virus, including, of course, the vaccine rollout that we touched on tonight and the efforts made to prevent hospitals from becoming overwhelmed. So a lot of the safety measures to be talked through tomorrow. I'll be joined by another expert panel, including the former Health Secretary, Jeremy Hunt, and also a former boss of Test and Trace to analyse all of the evidence tomorrow night. That's COVID Crisis, Learning the Lessons, which will be continuing tomorrow night at 8. Thank you for watching and good night.